Hey guys, welcome back. I was recently at a graduation for my younger son, and it seemed like every third sentence included how ChatGPT was going to replace standard education. Now look, I agree that AI may replace 40% of the jobs in time, but it'll never replace the creativity of the human mind. Or will it? I don't know. Everyone's talking about how you can write papers, you can create dialogues, you can even use deep fakes to simulate human speech and human characters. And we've already seen that, right, in the science fiction movies where characters are created on green screens and then put into the actual action. There's a lot of benefits there, as well as downfalls. The benefits are clearly that it's a safer medium to operate in. You don't have to worry about someone falling off a bridge or off a plane. Plus it reduces the cost and the carbon footprint and all kinds of other things. But the next step may be that ChatGPT, and not just ChatGPT, but all of AI, will be able to spoof life. There was a recent paper in the New York Times by Joanna Sternberg, who is a very reputed journalist, who basically talked about how she programmed an instance which replicated her. And for like $1,000 in a firm in Great Britain, they can actually take videos of you saying different things and create a deep fake of you. And it was so good that it could actually fool the bankers. Now you think about that. When that happens, you gotta wonder what's going on. So we took a look at this to see what the level of experience is in healthcare. And honestly, even as I practiced 10, 15 years ago, patients would come to me with Uncle Google's kind of medical review and tell me, I need this, doc, because this is what I have. And you would talk to them and you would say, look, let's go through the history and physical, and then let's do a couple of corroborative tests, because that's the history and physical will be 80% of the evaluation for any type of medical problem, and the remaining 10-20% will be from corroborative tests. And then you decide what the patient needs based on the evidence. But people are sidetracking that, and ChatGPT takes us even further. Is that a bad thing? No. We have a huge shortage of medical expertise, and I would say that if you can use this as a first-line triage, which basically says you need to go down this pathway or that pathway, it could be very effective. And particularly in India, where you have approximately 1 million allopathic docs serving 1.412 billion patients, 70% rural, 30% metro, if you could program something like this in regional dialects, how powerful would that be? So the next question I ask myself is this real or is it not real? So let's talk a little bit about ChatGPT in general, right? It's based on what we call a large language model. And what it does is essentially not create a reference-based database, but instead looks at sentences statistically to see what the next word should be. And it really is about neural connections. In your brain, you normally have lots of neurons, which are actually the fibers which carry the memories and the electrical impulses. And then you also have synapses, which are the connections between those neurons. In the case of ChatGPT 3, you have about 100 billion, give or take, maybe a little more, connections. And in ChatGPT 4, which just came out, you have 100 trillion. They say ChatGPT 4 has 500 times the neural capacity of ChatGPT 3 and rivals what the brain can do. But here's the kicker. The key to all of these AIs and machine learning and neural networks is they have to be trained with a huge amount of data in order to be accurate. So much so that in the initial kind of workings of ChatGPT, the data which was coming back and the questions which were being answered were not always correct. that will get better. And in fact, many of the firms like Google, for instance, with DeepMind, is training it with a medical database, and its results are there. I've seen papers which say that a similar product to ChatGPT on Google, on DeepMind, could actually pass the US medical licensing exam and score a 70 or 75th percentile, which is a little scary because it's a relatively complicated exam. I've taken it, and all the docs in the US who have been licensed take the USMLE Part 1, Part 2, Part 3. And so the point is, at this graduation, all the teachers were concerned because they were worried that the kids would be cheating, basically using it to write their essays for them. And yes, there are ways to quality check it and look at references, just like everything else, to make sure there's no plagiarism. But let's ask ourselves a more fundamental question. When we went from long math to the slide rule and then to the calculators, did they say we were cheating then? No. In fact, those slide rules and calculators became tools for us. I would say the skill sets will change in that the questions you ask with ChatGPT will be what define you, meaning that if we can ask questions and get answers more quickly and or scale the reach of what we have in place right now in a more efficient manner, then ChatGPT will have done its job. Now, it's a little scary because will the Terminator come? Not any day soon. But there are pundits in the technology industry who are talking about kind of governing and regulating this so that we have sort of the 3 rules of robotics, as Isaac Asimov had put them forth, where the robot will never do harm to a human. The real issue is, when will it be good enough that you can go to it? And I would say, in a large part, it's very interesting right now. It does give you some relevant information, and in my reckoning, it's probably better than a Google search. Is it up to the mark? Well, let's try it and see. So what we did for you is we took a few questions and we took a look at them to see if they were accurate and whether they gave evidence-based medicine. And so that's the thing I'll talk about in a separate video, but if you see all of my videos, I've given you video links in the description where you can go and see how I derived it. So that was the thing, right? When you do a math exam, you just don't give your result. You show how you got it. And that way the examiner or the teachers can see how you arrived at the end result. For me, that was always something that was very, very crucial, because if you can't see the data and see what evidence this is based on, it may or may not be pertinent. And we'll talk about that in another talk, that what are the levels of strength of data, type 1, type 2, type 3 in medicine. But it's critical that we have the references on which these things are based, and honestly, that's not always done. The second thing is, what we noticed when we typed in all these questions is that it always has a proviso saying that while ChatGPT is not a doctor and you should always consult your doctor before you take this advice, this is what it is. So they basically put a CYA in there, for those of you not familiar, cover your ass, so that they don't get sued for giving bad medical advice. But to be honest, for me, it was remarkable. So let's go through a few of them. So I did a few interesting puzzles, right? For these video talks, which we do, I wanted to write some scripts. So I threw in a few things. So the first one was, I threw in the summer safety tips, right? And I looked at this, and I'm just gonna regenerate the response here. Okay, so I put, write an article on how to protect yourself in the summer, right? So many of the things we found in here were fairly accurate, although a little bit vanilla, very plain, right? So they talked about staying hydrated, protecting your skin, being mindful of food safety, staying safe in water. And the conclusions they drew were pretty accurate and pretty dumbed down, right? This wouldn't be something I'm addressing medical folk with, but for the average user, it would be fine. Next, we checked on heat waves and what safety measures were there. And this was a little more there. And you'll see this talk generated. And I wrote my own, but just for fun, I was playing it and seeing it. And many of these same things were there. And so it's using the common database, and the more it sees, the more accurate it's going to be. Next, we went to sun protection tips. And this one was interesting in that some of the information was blatantly wrong. There's something called sun protection factor, which is a measure of how well a sunscreen product will protect you versus nothing at all. And when they talked about this, they talked about the amount of time that you can stay in the sun, and that's actually not very accurate. And so the take home on this is you cannot take everything it says as gospel on this particular topic. Then I talked about treating chest pain. And so the first thing it says is, I'm not a doctor, but I can provide some general information about chest pain. Chest pain can have various causes ranging from harmless to life-threatening conditions. It's crucial to seek immediate medical attention if you or someone else experiences severe or persistent chest pain, or it may be a sign of a heart attack or something more severe. Now look, if you tell me that, I would be scared out of my mind. And the first thing I would be doing is rushing somewhere. But that's not how it works in most cases. Until this gets better and uses feedback loops using your devices or something else, I think it'll be very hard to believe. So then let's look at some of the tips I gave you. Call for emergency help. There's a good one, right? That should be damn obvious, right? That if you're in trouble, you're gonna be called. If you're experiencing severe chest pain, especially if it radiates to your arm, jaw, neck, or you're having difficulty breathing, sweating, or feeling lightheaded, call emergency services right away. I don't know about you, but I don't need ChatGPT to tell me that. These could be symptoms of a heart attack, and prompt medical attention is crucial. Then next, stay calm and rest. Okay, if the chest pain is not severe or life-threatening, it may help to stay calm and sit down. But look, the truth is, staying calm when you have chest pain is a tough one, right? Because you're worried about everything and you're seeing it. I did a talk on this, on why heart disease is affecting such younger people these days. And when you see stuff like that, and you see someone pass away, that's not what you're gonna be. Next, take prescribed medication. And so, when I give you doctor's advice, if you have a history of this, the 3 or 4 things like aspirin, nitroglycerin, supplemental oxygen, and getting into medical help are kind of the things which you do under a doctor's care. But could you do those outside? Could you call your pharmacist, who's the other ChatGPT sometimes, and will kind of try to help you with what he's seeing other people do without any medical training? Or rather, I shouldn't say that. They do have a PharmD in most cases, but they don't have specific license to provide medical care like that, and they often do. But anyway, this is pretty generic. They also talk about chewing aspirin and seeking medical advice. So, this one they've sort of purposely dumbed down. I would say maybe a version could be built for docs and for ERs, where it takes in all of this information and gives the docs kind of what to do next. Because that would wipe out the boundary between the well-trained and the not so well-trained, and potentially get people outside their specialization to do the right thing early. So I think, it's fairly vanilla. And I think the more complicated and the more life-threatening you get, they're gonna be vanilla for litigious reasons. Next, we tried heartburn. And this one's pretty benign, right? Most people don't die of heartburn unless it's really not heartburn. And in those cases, if you have it persistently, we've talked about this, you need to get evaluated to make sure it's not heart disease, particularly in diabetics and in people with risk factors for heart disease. But anyway, this one was actually pretty good. They started out by saying heartburn, also known as acid reflux, occurs when stomach acid flows back into the esophagus, causing a burning sensation in the chest. So this one was good. If you've seen my episode on YouTube, which was well appreciated and kind of came to the point, this one follows many of the things which we said. The first thing they talked about was lifestyle modification, maintaining a healthy weight, eating smaller, more frequent meals, avoiding trigger foods, eating slowly and chewing thoroughly, avoiding lying down after eating. These are all the right things, and so they did that one really well. Then they said adjusting your sleeping position, elevating, perfect. And then they talked about over-the-counter medications. these are things which you can get without a license to practice medicine, and they include antacids, H2 blockers, and proton pump inhibitors. Perfect. Now, these natural remedies they've talked about are there, but the question is there evidence to support them? And this is what your grandmother or your mother might tell you, but you have to be careful, because if someone does this and they get into medical trouble, this could be a problem. But they also said that if the heartburn persists, or if you experience severe symptoms like difficulty swallowing, unintended weight loss, or persistent vomiting, it's important to seek medical advice. So they did do that. So I would say this piece was pretty accurate. Now we talked about severe headaches, and we tried to be a little sneaky, and we said, after a history of blunt force trauma, what is your diagnosis? So I wanted to see if this instance could actually do a little bit of diagnostic work. And again, it gave me the proviso. It said, I'm an AI language model, and while I can provide some general information, I'm not a doctor and cannot provide a diagnosis. But what they said is severe headaches can have various causes, and a thorough medical evaluation is needed. So they've framed themselves so that they've covered their asses. Next, they said, given the history of blunt force trauma to the head, it's important to consider the possibility of head injury or concussion. That's perfect, because those are the two things I worry about. I also worry about head bleeds, which they didn't talk about, but that's in and of the same range. Head injuries can lead to symptoms such as headaches, dizziness, nausea, and cognitive difficulties. Other potential causes of severe headaches include, and they gave me a nice differential diagnosis, migraines, tension headaches, sinusitis, cluster headaches, etc. It's crucial for the patient to seek medical attention promptly to receive an appropriate evaluation. While they give you the information, at the same time they also framed it, because in my reckoning, if someone comes in with a head injury, they need to be evaluated. And the critical questions to ask are, did you have loss of consciousness? Are you having nausea and vomiting? Are you having severe headaches? And are you having any type of disruption in sensorium or the ability to move? Or are you having worse things like loss of bowel or bladder control? And if those are going on, you would get a quick CAT scan. If they've had any loss of consciousness, you would get a CAT scan. So this one for me was not as helpful. It gave you kind of the generalized stuff, but I wouldn't trust this to help me. So it gets a fail on this one, in my opinion. I don't think it can do the diagnosis work, and I think it's being bland on purpose so they don't get sued if they make the wrong diagnosis. Now this one was interesting. We put something in which was very specific in medical jargon. And we said, a child presents with an infective skin lesion of the leg. Now, I don't know what user would be doing that except for a doctor. The culture was done which showed a gram-positive cocci chains and hemolytic colonies. Which test will best identify the organism? We didn't know if this would get it. And the interesting part is it was able to do it. Based on the given information of gram-positive cocci chains and hemolytic colonies, the most likely organism responsible is the Strep pyogenes. That's actually correct. Also known as group A strep. So this is one of those basic medical school things that you learn in PATH and whatnot. To confirm the identification of the organism, several tests can be conducted. One is the catalase test, and they go on to talk about what it does and the enzyme catalase which it's looking for, and how it can differentiate between Staph aureus and Staph pyogenes. Then there's a bacitracin susceptibility test, which basically tells you what the susceptibility of the particular bacteria is. And then they also have a rapid antigen detection test. So I thought this one was pretty good. And then at the end, they said consulting with a healthcare professional or clinical microbiologist is recommended for an accurate diagnosis and appropriate treatment. I'm waiting for this to get to the point that you have a medical droid that can automatically take all this information and give you an answer where you're in the boonies where there's no doctors, right? And when we get to that point, then you'll be able to democratize healthcare adequately. All right, let's go on to the next one. I was curious to see how good this was in figuring out how to do procedures. And so I asked it, how do you perform an appendectomy? Again, it gave me the standard answer, but it also told me what the appendix is. It's a small organ located in the lower right side of the abdomen. They told me that it was an emergency procedure when it's inflamed or infected, known as appendicitis. But again, kind of preface this by saying, please note that I'm an AI language model and not a medical professional. The interesting part, I did this just as a thing to write a leave and license model for renting something. And it said again, it couldn't do it, and even was more particular. So it sounds like the lawyers have gotten in there and they've blocked all use of ChatGPT on the surface level for writing contracts, because that would mean they'd be out of a job. Who would want to be that, right? But my suspicion is with time, that and blockchain will wipe that part of the industry out. Anyway, moving on to this appendectomy, it went through the steps. It went through anesthesia, it went through the incision at McBurney's point, which is accurate. It talked about an open appendectomy in basic terms, about size of incision, and then it talked about a laparoscopic appendectomy in general terms. It talked about how the appendix was removed and how you sew up the base or tie it off and then clip it. It also talked about stapling in the case of a laparoscopic appendectomy. It talked about closure and it talked about recovery. So I thought this was quite interesting because it brought out what you see in general. Now, I did not ask it to do heart surgery or circ arrest, aortic replacement, or something a little more defined. Maybe we'll do that in the next one. But I think as a rule, my final conclusion on this is that ChatGPT and its kin, large language model constructs, as well as AI, are evolving. I think it now has the power to simulate a brain, and in many ways it's like a brain in that you have neurons and you have connections between them. The construct is artificial in the case of a large language model in that it's not a context database. Instead, it's a predictive statistical model as to what would be the next word. My hypothesis, and rather thesis, is that with time, as we train this adequately, and it's already happening, we should see even better ways of doing this, and we could create a medical model just for doctors. And for us, you know, we know the difference, right? But if it could at least do the basic work and help us triage, which would take a lot of heat off the casualty or emergency rooms, as well as giving us access in places where there's no doc using automated means. At least then we could treat the patients who are at highest risk. And as we evolve and move farther along, we could decide, because you don't want to flood an emergency room or casualty or local clinic with things which aren't requiring medical intervention or a high-level consult. At the same time, the key is, if it's life-threatening, you have to have someone at least look at it at some level who has medical training. And honestly, not all docs are created equally. Some have not seen some of this stuff and some have. And so this may actually help with continuing medical education by leveling the playing field and having the latest data in there, depending on its training, and helping out everyone be on the same level. But anyway, for me, this was fascinating, and I think you should find it the same. The take home is this, that you can use it to get information, and it's probably a little more powerful, not a little, a lot more powerful than Google, in my opinion. And hence, Google's felt the challenge and is now ramping up resources after Microsoft invested so much in ChatGPT and OpenAI. But what I see is an evolution in this, and in the next 1 or 2 years, forget about 5 or 10 years, 1 or 2 years, you'll see things which play right along with EMRs and electronic medical records, which can easily discern between one condition and another, give you differential diagnosis, and tell you what tests need to be run, and will save time and see many more patients than what you can do as a doc in one instance, and thereby scale and democratize healthcare. Anyway, I thought this was really interesting. Thanks for joining us. I'll see you in the next video. And as always, remember to like, subscribe, and share, and hit the bell icon so you can see even more things. Don't forget to leave in the comments what your thoughts are on this, because I would really, really be interested in seeing what your interactions, both if you're doctors using this stuff or playing with it, or if you're patients, or if you're the government or hospitals. I would love to see what your inputs are. Thanks, guys. See you later.